The initial aim for us was to examine whether there are factors in patients with MS that receive a recommendation for initiation of a high-efficacy treatment, whether there are factors that influence the time delay between the recommendation and the actual initiation of their treatment. So that was of interest in our study, and therefore we collected data from all outpatient clinic visits of MS patients at our University Hospital in Frankfurt between 2015 to 2023, and we included a total of 160 patients. All of them received the high-efficacy treatment recommendation, and the most of them suffered from the various types of MS. A minority also had other neuroinflammatory diseases. And we could see that the overall time delay was 223.5 days across our group. And when we looked for factors that showed a significant correlation with time delay, we could see that there was a group of patients that were older, that had already achieved more disability accumulation, both at the time point of treatment recommendation and time point of treatment initiation. The ones with a progressive disease phenotype, such as SPMS and PPMS, as well as those with a lot of previously used disease-modifying treatments, and those who had newly diagnosed chronic diseases in the meantime between treatment recommendation and initiation. So those were the patients where we saw that we had longer time delays. It took more time until they could start their therapy. On the other hand, we could also see that patients that displayed more disease activity at the time point of treatment recommendation, such as the presence of relapse, a clinical relapse at the time point of the recommendation, or a high number of relapses during the past 12 months before they came to us and received the recommendation. This was showed negative correlation, so they had less time delay. I think it's not only about changing from one DMT to another DMT, but also when we found a patient, or when we see a patient that is very likely to profit from a higher efficacy treatment, then those patients, we know right now from several studies of the last few years that patients do have more disability accumulation the later they start their treatment. So there is a correlation, and so in this situation, as we can right now from the results of our study identify such patients, as we know this now, we can take a closer look on them and maybe prevent some of those patients from experiencing such a time delay.